Hello there, mate. It's me, Dawn. Okay, right. Hi, guys. Today I'm going to be telling you about what happened to me when I felt a breast lump. I'm very open, I'm very honest, and I think part of that probably comes from just not giving a fuck, but also being a doctor. And I think my breast lump story was influenced by the fact that I am a doctor. So today I want to talk to you about what happens if you ignore your breast lumps like I did, and just generally my breast lump story, and maybe I'll even show you, I don't know, we're not going to get boobies out, but tell you how to examine your boobs, because I don't know if we're ever told really, are we? Maybe that could be my good deed for the day. So my breast lump story starts about a year ago, which, look, I'm not proud of it, okay? I was heavily judged by my fellow colleagues, seemingly heavily judged. In fact, no, I was, because I think they were judging me, but I was like, yeah, I did leave it a year. The issue is with being a doctor, okay, is you self-diagnose and you go, it'll probably be all right, because I thought it would be fine. I later learnt that that's not the best tactic. So yeah, let's talk about what happened. A year ago, I was having some, we'll call it hormonal issues, and my boobs were like going up and down, like swelling, etc. And I noticed this like mass swelling, hardening here on my left outer boobie at the top. And I noticed it, and because I examine my boobs every week in the shower. It's not like I don't like time it, specifically. Okay, it's a week now, right? It's on the calendar. Better examine my boobs. No, I just do it when I remember. So it's probably about 1 to 2 weeks, which is about right. You don't need to do it every day. And I examined them, and then it went back down, and I was like, oh, it's probably all right. It's probably just like hormone related. If you come on your period or whatever, then it's gonna go up and down, whatever. And it sort of mildly hurts a bit still, compared to the other side. So I was like, well, if it's cancer, it's not gonna hurt, is it? So anyway, I left it. I don't see the doctor very frequently, except myself. Obviously, I see myself 24/7. And I'm not going to ask my doctor friends to examine my boobs, although I wouldn't put it past some of them to not mind doing so. So I just monitored it, and I thought, well, if it gets worse, then I'll go see my GP. But we all know what the GP's system issues are like in the UK at the moment, and that shouldn't put anybody off, but I guess it kind of did. I was like, well, I'm not going in to see them. I do everything online. I call them. And I also just convinced myself that it was okay, for better or for worse, because I would later come to regret that decision, but there we go. So for a year, I sort of on and off ignored it, thought, well, it's not getting any worse, so whatever. And I think also I convinced myself, well, none of my family have breast cancer. I don't have a history of it myself. I am young, relatively, in terms of having breast cancer. It's mostly in like 30, 40, 50, 60-year-olds, I want to say. So I hadn't quite hit that like danger threshold yet. So I was like, meh, it's probably all right. I just kept telling myself it was okay. And I guess it remained in the back of my mind for that whole year, but very like mildly, like I wasn't worried. And then it got to the point where I was going to see my GP. I booked an appointment and I fully was fine with it. I was like, yeah, I just want to book an appointment for like whenever you've got the next one. And that was 2 weeks time, which was fine. I was like, whatever. I've waited however long. I'll wait 2 weeks. I actually went to see my GP for a sinus problem. I have, I guess what you'd call eustachian tube dysfunction on this side, and sort of chronic sinusitis, and I now use a nose spray. The issue is that the tube gets I don't know whether this is even interesting. The tube gets blocked, and anyway, you get pain here, maybe sometimes here, and it feels blocked, whatever. I went to see her for that, and on and off before going, I was like, should I talk about my breast lump instead? And I was like, nah, it'd be fine. Dawn, you booked the appointment for your sinuses, so do that. You don't want to be one of those annoying people that goes and then goes, oh, actually, I've got this. But I got there. She examined me extremely quickly, which I'm not like judging her for. She's a fully qualified, experienced GP, and it's a sinus problem. problem. And also I'm a doctor, so I've basically diagnosed myself. And I think that's the thing, when you see a doctor, like, they generally know what they need. And I think that's, in a way, sometimes the problem with being a doctor is you're like, well, I have this, so I need this. And that's why I don't often see the GP, because I just say to them, oh, I don't need to see them because I don't have a lot of problems. But also, I know what I need, and I know how to treat myself as well. So I just don't see the doctor. And the only time I see the doctor is when I need something and I know what I need. It's rare that I'm like, I don't know what I need. But to be fair, when I had the sinus problem, I actually didn't look it up or anything. It's a very GP problem. It's not something we see in hospital very often. So, I wasn't like, I know what I need, give me it. She actually suggested, I didn't know if I needed like an ENT referral or whatever. And she said to get some nose spray, but whatever. So anyway, she was chatting to me. She obviously knew I was a doctor because I don't know, you can just tell the way someone talks mainly. I was gonna say the way someone walks, the way someone looks, but no, that's not usually it. Either they tell you or they talk in a way where you're like, are you medical? And also if they come in and go, yeah, I've got sinusitis, and then they go, well, why? And it's like, well, I've got, I could tell I've got some eustachian tube dysfunction, I've got pain in the sinus area. Like, only really a doctor would say that. If you're a patient, you say, well, I've got pain here, and I've got pain, or you might be a patient that's like, I've Googled it and I think I've got sinusitis, but most patients will be like, I've got pain here, and I don't know what it is, but it really hurts, and my nose is blocked, or like, they might not even tell you that much, you have to like pull it out of them. So when you see a medical person, they might not be a doctor, they might be like a pharmacist or a nurse or something like that, you can kind of get the gist because they are telling you all the information. You don't need to pull it out of them, and they've already sort of come to the conclusion themselves. So anyway, she then gets chatting to me about being a doctor. What kind of doctor are you? Are you in training? Blah, blah, blah. Where are you working? All the same questions. I work in Bristol, BRI and Southmead, and I work as a locum, and no, I'm not specialised. I don't know why I answered those questions, but you probably didn't want to know. So there we go. I answer those questions, and then we're kind of sitting there, and I feel like we've probably been there for less than 5 minutes. And I was like, in my head, I was like, oh, do I do it? It was literally like a fucking minefield in my mind. I was like, do I do it? Do I not? Do I say it? Do I not? I don't want to be that person that's like, okay, bye. By the way, like hand on the door handle patient is what you call them. And you got your hand on the door handle, and then you're like, oh, by the way, I've had like chest pain. So I didn't want to be one of those people. So I seized my moment. And I was like, look, I said to her, I'm sorry, I don't want to be one of those people. But, in my head, I was like, we're fucking chatting. You can't be that busy. Which I know is a horrible, bitchy thing for... Is it bitchy? No. Which I know is a sassy thing for me to think. But, if she's busy, she's going to be like, okay, bye. Like, we've seen each other. That's all you wanted. Off you go. But she was like making small talk with me. So I was like, well, I'm here. And also she was fucking quick. So I was like, I don't know. Anyway, I do feel bad, and Tom always says it. He's like, Dawn, you shouldn't feel bad for trying to access healthcare. And I'm like, but I do. I feel so guilty for like, Tom's always like, why don't we call 111 or the ambulance? And I'm like, no. That makes me sound like I'm always like on death's door. I don't know, I'll have pain or I'll be throwing up. And I'm like, no, I need to be like throwing up for a long period of time to call an ambulance, for fuck's sake. And then even then, I don't need an ambulance. I could probably just go in the car, or I could just, treat myself. Or, I know the threshold to need to be admitted. So I'm not gonna go and see a healthcare professional, or especially call an ambulance. Fuck me, I'd have to literally be immobile, like, to need an ambulance or on death's door. And Tom kind of, like, he does get not annoyed at me for it, but he's like, for God's sake, Dawn, just, you don't need to be so, I don't know, stubborn or whatever. But I'm like, maybe I shouldn't burden all of the, all the weight on me. But also I know what needs to go to hospital, and I know what doesn't need to go to hospital. And a 28-year-old, fairly fit and well woman does not need to go to hospital. Like, you don't. So, not me anyway. And I don't need to go if I've just thrown up once. If I was throwing up for a long time, I get it. But even then, I'd probably just go to my GP. Or I'd probably, I don't know what I'd do. It's situational. But it's it doesn't matter. Whatever I'm talking about right now doesn't matter. Let's get back onto the story. So, she's like, okay, take off your bra. And she examined me very quickly. I was like, yeah, it's here. She was like, oh yeah, there is a definite lump there. And I was like, I thought in my head I was going to go there and she was going to be like, yeah, it's just like fibrous breast tissue. That's genuinely what I thought she was going to say. So when she said, oh yeah, I think you need to go see the breast clinic, I was like, what? I've been sitting on this for a fucking year and now the doctor says I need to go to the breast clinic. For fuck's sake, Dawn. And then that is when the catastrophizing started. Oh my God, I can catastrophize for England. I think some of it is my medical training. You know, we have to rule out the worst possible causes first, right? The worst possible scenario. Cancer, stroke, heart attack, blah, blah, blah. And in my head, I was like, oh my God, I've got breast cancer and I've got bony mets and metastases and I've got brain mets, but I just don't know about it yet. And I was spiraling out of control. I was like, oh God, and then I started to plan my funeral. Like literally in my head, I was like, right, where do I want to die? Honestly, it was really scary. And I don't want to sound dramatic, but because this is literally what was going on in my head, I was freaking out. And thank fucking God for, I tell you what, the NHS cancer, especially breast cancer or breast clinic services in the UK are fire. I'm telling you, they are so good. If you have a heart attack or if you have breast cancer, you best believe you're having a great time. Like, you might not be having a great medical time, but you are having a good time in terms of you're seen quickly, you are looked after well, there's a lot of post-care services. Those two in particular, even stroke actually, those three are the best, like not in terms of having them, they're not good in terms of having them, but they are the best in terms of caring for you, especially afterwards. You know, you get referred to all these different things, you get cardiac rehab and stroke rehab, and it's all free, and they come to a house, and I worked on the stroke unit. It was amazing. So anyway, all of these fucking catastrophes start going through my head, and I was literally like thinking about all the people that had died really young of cancer, and I was like, oh my God, they wrote things like books on in their deathbed, and then I was really trying to come to terms with my death. And honestly, like, I sound like a fucking drama queen, and that is because that's what's going on. That was what was going on in my head. I was like, if I've left breast cancer for a year, you better believe if I'm 28, because people who have cancer when they're young, it's aggressive, right? And yes, I know it makes no logical sense that if I had cancer that had metastasized to my bones and my brain, by a year's time, if it was that aggressive, I would either be dead or I would have symptoms, brain symptoms. But then you start thinking, well, maybe I have. Maybe I had a flashing light, or the headaches that I've been having are not stress, and I've got brain mets instead. And oh boy, do all these things start going through your head. And maybe it's I don't know if it's just me. I am a catastrophizer. I get it. I have anxiety. I understand. But also, I felt extremely, I don't want to say guilty, but fucking stupid for literally leaving it for a year. I was like, wow, what have I done? I honestly thought she would just be like, yeah, you're fine. Like, it's fine. Just go. And that would be it. And I would have been happy with that response. So there I am, freaking out. She tells me it might be 2 weeks before I get this appointment. And I was like, okay, fine. Like, it's fine. I then put it out of my mind. But that same day, I'm not fucking kidding, I went to the GP in the morning. She sent off the referral like almost straight away. And I got the call to book the appointment the same fucking day. I can't even believe it. Like, I needed to tell this story because it is so good. This story is incredible, okay? And this is where it only gets better, all right? Then, I can't remember what day it was. I think it was like Wednesday. They then offer me an appointment, okay? So they call me up, I'm thinking like, oh, it's going to be like 2 weeks' time. Anyway, they call me up and say, right, I said, when's your next appointment? I just said, I'm just going to come to the first one you have. If it's fucking in 5 minutes, I'll be there. If it's midnight, I'll be there. I don't care. I just want it done. And because the best thing about these breast care clinics is it's what they call I don't know if they call it this, but this is what I'm going to call it, a one-stop shop. You go there, you see a consultants are the bomb. Like, come on. It's amazing. Like, sometimes I really think about things and I think, wow. I mean, I've seen some good consultants and I've seen some bad consultants. And if you want to listen to the worst consultant, I actually have an episode on my podcast. I should do the best consultant because I've seen some really fucking great ones. Anyway, consultants have a lot of experience. This consultant, probably amongst many other, are they just breast consultants? I guess so. Anyway, had felt a lot of boobies. So he felt the boobie. He felt both boobies, actually. The consultant was the one that was like, so how long have you had your symptoms for? And I was like, a year. And he was like looking down at his paper and he was like, a year? And I was like, yeah. And he was like, And I could tell that he was fucking judging me, all right? And I was like, look, okay, I examined it myself. I thought it was fine. And I just left it. I'm sorry. Sue me, okay? So I felt the judgment from him. Anyway, I then went behind the curtain. He took my history. He actually wrote in the letter, though, my main symptom was pain. And I wouldn't say my main symptom was pain, although I did have pain by the end of it. And I've still got a bit of pain now. I think because it was poked so much during that time, honestly. I had a lot of people feel it. So I went behind the curtain, and I tell you what, I've had a few intimate examinations with doctors. Some of them you have chaperones with, and some of them you don't. I'm not bothered if a chaperone is there. In fact, actually, if they're a male doctor, I trust doctors, of course I do, but I would want a chaperone there. There are some dodgy people out there, okay? I don't want to be in a situation, because I am a doctor myself, I don't want to be in a situation where that gets messy, all right? So and I'm sure they're very happy to have a female chaperone there too. So it's all fucking win-win, okay? So there's something weird about when I go and see a doctor and there's a female HCA usually, or nurse, but generally HCA chaperone there, they have a weird habit of watching me get undressed, and I find it very uncomfortable. So whenever I saw a patient the other day, I fucking either leave the room, go behind the curtain, or turn around and say, let me know when you're done. I don't stand there and watch them get undressed. Like, how freaky is that? In fact, I had a female lower down, gynecological examination once. The HCA watched me take my fucking pants off, and just she wasn't talking to me, she wasn't making small talk, she was just watching me. And awkwardly, of course, I was fucking awkward, and I was like, do you want me to take my pants off too? And obviously I knew the answer to the question, lady, and she was like, yeah, obviously. But I was like, that was the cue for you to not watch me take my pants off. It's extremely, if any HCAs are listening, any people who chaperone, any nurses, any other doctors, please stop watching people take their undergarments off. I can't cope with it. In fact, next time I might say, can you fucking turn around, please? Because I can't cope with somebody watching me. And I know that you're then going to watch my bits. I don't know if it's because they know I'm a doctor and they're like, oh, I've never watched a doctor get undressed before. Let me watch this one. Why do you need to watch me? There's no reason for you to watch me unless you have like a weird fetish or something. I'm getting very passionate about this because I find it extremely disconcerting and I really don't like it. If any of you people, if I watched, even if me watched one of my patients getting undressed, it would be weird. If I watched a male patient getting undressed, it would be weird. I'm sorry, but they need educating. Someone needs to educate these people how to not watch somebody get undressed, because I can't cope with it. In fact, that's the fucking last straw for me. I've flipped here. I'm going to tell them, can you not watch me, please? I'm going to have to practice it so I don't sound like a bitch. But do you mind turning around, please? No, it still sounds bitchy because I don't know how to say it, all right? Okay, Dawn, calm down. No one's gonna... I just don't understand it. I don't understand. Is it because... I just don't know why they do it. I like to think that it's not some weird fetish. I like to think that it's not because they want to watch a doctor get undressed. I like to think that it's not because they want to have some kind of power over me. I like to think it's because they don't want to make me, I don't like to think that it's because they want some kind of power over me. If I said all of that in the wrong way, like in terms of like no, yes, no, please flip it round. I don't want to know, I don't know. Anyway, do they just want to check that I'm taking my fucking underwear off correctly? Maybe they want to check that I've taken it all off. I don't know, but like, just be clear. What do you want me to take off? Say, can you take all of your lower clothes off? Take all of your clothes off from the waist down. Easy fucking peasy. And then, yeah, you might get some shoes and socks off, but is that a problem? You could say take all your clothes off from the waist down, but you can leave your socks on. Easy. Fucking one sentence right there. Or can you take all of your clothes off from the waist up, including your bra, or not including your bra? And then if I've made a mishap, I'm sure we can figure it out. I'm sure you can get me back off the bed. It's not as though I'm 80, all right? Get me back off the bed and I'll do it quickly and then I'll get back on. Also, don't watch me then get onto the bed. It's embarrassing enough as it is. I'm not embarrassed, okay? I am honestly not fucking embarrassed. But sometimes being a 5'1" young lady, getting up onto those beds is a task. And when you've not got any underwear on, it's not the prettiest sight. All right. So also then getting your feet in those bloody things, just please, maybe they just don't realise they're doing it. But if you don't realise, listen to this and then just turn around. I don't care if you're in the room. I just don't want you staring at me. I don't care if you can see me out the corner of your eye. It's when you're like, if you're just listening on the audio there, that was me giving you the eyes. Okay, anyway, that's me. That's my rant over. Anyway, the consultant was fine. He didn't watch me get undressed, thank fucking God. And he came in past the curtain. He felt it. He was like, yeah, there's a lump there, but I think it's just fibrous tissue. I was like, yeah, my man, give me a high five. Give me a booby high five. And we didn't do that, but he was a little bit, not awkward, but he didn't have so many social skills. I don't think we made eye contact once. So, you know, what are you going to say about that? I don't know. So, yeah, he said, but we'll get you an ultrasound and if they see anything, they'll biopsy it. And I'm pretty sure they said they'll biopsy right there and then. I was like, okay. So anyway, I go and sit in actually, no, I don't sit in the waiting room. I go straight in. They take me straight from that room into the ultrasound room. And this lady who I didn't really know who she was because she might have introduced herself, but also I thought she might have been scanning me, but then she sort of just didn't do anything for a while and she got me onto the bed and gave me like a thing. I don't mind someone watching me get undressed when I'm taking my bra off. I don't know. But when somebody's watching you take off your lower half, that's just too much. I think because you can turn around and then it's just back. It's not back and crack, okay? Whereas if it's just upper, then it's just taking your bra off. Okay, so I lie on this thing, put this sheet over me. It's basically a piece of paper. It's not a fucking sheet at all. I put this piece of paper over me, you know, that like weird papery, fabricy stuff they have over the beds. And then I just lie there and she sort of loiters and I was like, are we going to do anything here or are we just lying in a dark room together? And I don't know, I didn't ask. I was just sort of like, okay. I just waited. I was being patient. I was like, I'm sure the main event is going to happen soon. Anyway, suddenly, a consultant bursts. And when I say bursts, I fucking mean it. Like, he flies through the door. A different consultant, a radiologist, right? He flies through the door. He like bursts in. It's like something out of a movie scene. Like, you know, when someone's like, aha! But he was like, hello, are you blah, blah, blah? And I was like, yeah, hi. He was very nice, actually. It wasn't like weird, which is, you know, something I always ask for in my intimate examinations. But he burst through the door, we get acquainted, and I think whenever I fill out a form, if there's doctor there, I'll put doctor. But if there's no like choice, or, you know, it doesn't really matter, or if it's a formal document, then I don't put doctor. So often it is useful for people to know that you're a doctor when they're doing an examination on you, because I don't want to be like snobby, but I want someone to talk to me in a language that I understand, and also then they know I understand, because I don't actually understand when they're like, oh, it looks a bit funny. Like, well, that fucking means a lot, doesn't it? Like, I want to know, what does it look like? And I want to know in the medical terms, because that makes more sense to me than you going, oh, it looks a bit, you know, it was a bit white. It looks a little bit hazy. No, I want to fucking know. So I often think that not being a doctor, obviously it does help, but having doctor and them knowing that you're a doctor so they know what language to use does help. So anyway, he knows I'm a doctor. And he asks the usual questions, and he's like, oh, where is the problem? So I say here. So I'm like lying down, we're in this dark room, and we're watching my boob on TV, pretty much. So he is like sweeping with this probe, and it's fine. I can't remember if he did the other side as well. I think he did, actually. He did the right side as well, just to compare. But what you could see on the scan, and he talked me through it, which was nice. But it's kind of weird when it's your own body, but there we go. I've had ultrasounds before, mainly actually I did it as a medical student. I acted as like a scanning body, like so a body for people to scan. So I've been scanned a lot, so I've seen it, you know, I've seen my body inside, and ultrasound scanning mainly. And yeah, he's being like, oh, here's the muscle, and here's your lungs, and he's the bit of the lump you can feel. And it was basically, you could see that it was like fibrotic breast tissue, which is normal. So the moral of the story, the end of the story, is that I did have a lumpy boobie, but the lumpy boobie was fine. And that isn't the moral of the story, but anyway, so basically I get discharged from there. I get home, and then I think it was like the next day or the day after, on Monday, I got the appointment letter through the post. It was Monday or Tuesday, and I was like, I've already had the appointment. You don't need to send me a letter. So that was quite funny. The appointment letter got there slower than I'd already had my appointment. And then I think literally like the day after, my letter for my results came, and it was just like, yeah, it was normal. Examination, you know, fibrotic, but we scanned and showed fibrotic tissue. So I breathed a huge sigh of relief. I don't think I said, actually, I got the appointment on, so they called me, I saw the GP on like Wednesday, like I said. I got the appointment, they called me on Wednesday. I got the appointment for Saturday, and I had friends over that weekend, but I was like, I literally don't give a fuck. I'm not going to be able to like relax and also I think they said the next one was like further away, and they'd put on these like extra weekend clinics. And I tell you what, I think the NHS on the weekend is pretty good, to be honest. Like, there's less people around, and if you've got an appointment, it's pretty good, you know, it's less busy, and you just go through. There was a lot of people there, well, not a lot, like maybe 5 females, like patients in the waiting room, and then people had people with them. But yeah, I got the early appointment, it was like 10 a.m, and then, you know, got back, and also then my day was just worry-free. I was like, I don't have breast cancer, so I started cancelling all of my funeral plans, and, you know, started planning my life again. No, I didn't actually make any funeral plans, but in my head, I was freaking out. Basically, what I want to say is, number one, even if you're a doctor, don't be that idiot who just fucking leaves it. Like, I have learned that, and I've been like, why did I do that? I was very annoyed at myself, and I should have just gone. And also the doctor, the consultant that saw me was like, really? You left it a year? Yeah, sorry, sir. And next is, I thoroughly praised the NHS breast care system. Very, very good. It's very well funded, which helps. And finally, I don't remember what my last point was. That was it. I'm pretty sure it was just 2 points. Don't leave it. And, I guess I could also summarise and say, if you're acting as a chaperone, please don't watch people get undressed. Thanks. I'd really appreciate it. But maybe next time, like I said, I'll be like, sorry, do you mind turning around? Do you mind not watching me? I need to practice how to say that without sounding extremely desperate. Please don't watch me. Please. I don't want to raise any concerns, but I also just don't want to be watched. Imagine this. You're about to have sex and they're lying in bed watching you getting undressed. I don't know if that happens, but it sounds distressing. Anyway, I was going to tell you how to check your boobs, wasn't I? All right, I think you should do this once every 2 weeks. Sorry, is that right? Once every week, every 2 weeks. I'm going to show you. I'm also going to talk through it. So if you are listening on the podcast, don't worry. And when I say listening on the podcast, I understand you're all listening on the podcast. But I do actually do a video as well, and it goes on my YouTube. So, there are people just watching. But if you're listening, don't worry. You won't miss out. You can go over and watch the video, I suppose, as well. So, get in front of a mirror. Take your bra off. If you're not wearing a bra, doesn't matter. Just get your boobs out. So what you should probably do is have some good lighting and do it on a day when, they're not sore from your period and there's nothing going on there, okay? So stand arms above your head and look at them in the mirror. Now, obviously your boobs aren't going to look the same, but do they look like they normally look? Are there any lumps, any skin changes, any redness, does it just look weird? Like, does it look different to the other one? They're going to be different sizes, yes, but you shouldn't have any like nipple inversion or something coming out of your nipple if you're not pregnant, or any skin changes, so, if it looks like orange peel but not the orange colour, just like the weird dimpliness, that's, you need to get that checked out. So once you've had a good look, don't forget also that the breast goes into the armpit, so you should also feel the armpit. Number 2, start with one breast. You don't examine both at the same time. So you need to, let's say we're starting with my left breast. So we use my right hand and you can lift. Also, you can push your arms against your, put your hands on your hips and push your arms in towards each other, like you're squeezing your hips with your hands, and do that as well. So above the head and hands on the hips and squeeze. Next, hand on your head, so left hand behind your head, and then work in a systematic fashion. You might want to do this in like a spiral fashion. I usually do that. I start at the nipple and I work my way around and you sort of massage it. It's like a little massage. And what you're feeling for is something that feels abnormal. And generally the problem is breasts are lumpy. That is a big problem, in my opinion. It would be easier if they weren't, and then you could go, that feels like a lump. There we go. But the problem is that you're finding lumps in lumps. It's like trying to find a piece of straw in a haystack. Like, they're pretty much the same. So the difference is with a dangerous lump is, number 1, it gets bigger or changes, and number 2 is it feels different to the rest. So yes, it might feel lumpy, and that's why I got my fibrotic lump checked out, because it felt harder than the rest of my boob. It doesn't have to necessarily feel like a lump in terms of like round. It might feel like a craggy stone, or it might be like an oval shape. It doesn't have to necessarily be round. So anything that feels firmer or different. And also, just because you feel a lump that one time doesn't mean you need to go to the doctor every time that, you find something, unless it is very concerning, obviously. But it might be that you feel it again, and it might go down with, it might disappear and you might go, oh, okay, well, maybe there wasn't anything there. But if it's persistently there and if it feels different to the rest. So you go around, and make sure you feel all under as well, and then all the way up to where the breast tissue goes here, and then you go into your armpit and you feel all around your armpit for any lumps as well. Repeat on the other side, and then you're done. So I find it good to do in the shower, mainly because I'm already naked, and also because I remember, and also because you're wet. So like the wetness means you don't get any it's just nicer to also you can do it whilst you're cleaning yourself, put some soap in your hands, and then you're actually 2-in-1 productive breast examinations. Am I right? Yes, I am. So yeah, I mean, obviously if you find something and sometimes you don't know how long it's been there. So if you're only just starting to examine your breasts, then if you do feel something abnormal, don't wait and go, oh, Dawn said to, see how it goes. Then, you might want to go and get it checked out. But I'll leave that up to you. Yeah. It is a tricky thing to try and feel because they are so lumpy. But if you examine them regularly, then you kind of get used to feeling what is normal for you and what isn't. But if you do find something, then go and see your GP. And then if they say, oh, that feels fine, then that's good. And then you can go, okay, that's what normal feels like. If they go, okay, we'll go and get you scanned, then that's fine. Because then you've got peace of mind that it's been scanned. And then you go, okay, on the scan, it was normal. And that's what normal feels like. And you kind of get an idea of what do my boobs feel like, and also what do they feel like when I am not pregnant. Well, yeah, pregnant, but when I'm on my period. That's the word I was looking for. So anyway, I hope that was helpful. There we go. That's my very interesting breast lump story. I wish that I hadn't left it so long. That is my biggest moral of the story. And it's funny because I do examine my breasts so much, but just because I'm a doctor, I thought that I was invincible and I knew everything. And also I don't like burdening the healthcare system. So I was like, I'll be fine. There we go. I hope you enjoyed it. Tune in every Monday and Thursdays for, fun life chats. And I've got an itchy armpit now. I do health, wellness, well-being, and you can go check out my previous episodes as well. I do lots of interesting topics and, basically about life, mental health, self-improvement, self-growth, self-love. Just helping you live that normal, difficult human life. Okay, yeah, so if you are listening, you can go and watch the video on YouTube. The full video is up. And if you are watching on YouTube, hello, but you can listen on the go if you don't have YouTube Premium, in which you can just listen on the go and you can download it. But if you want to listen on Spotify or anywhere you stream podcasts, it's pretty much on literally all of the podcast streaming apps, then just type in Backseat Positivity into the search bar and it should come up. There we go. Please give it a rating if you enjoyed it. Please give it 5 stars. Thank you very much. And if you want to leave a comment. If you want to give it a like. I have to ask you to do all of these things, but if you don't want to do them, then that's fine. But it would really help the channel. Anyway, thanks so much for listening, and I upload every Mondays and Thursdays, and I will see you next week. Bye.